Drawing a comprehensive care plan for a patient is one of the essential responsibilities of a nurse. This helps you to assess your patient. Hi guys, in today's episode of Learning, today we are going to learn how to draw a comprehensive care plan, but in the simplest form.
The nursing care plan has three main sections. The first section is the patient particulars, where you input the patient's information, problems, allergies, and strength. The inner section is where you diagnose the patient, you give your nursing orders and your nursing objectives, and then you evaluate. And the last section contains medications, other treatments, and laboratory investigations. To start a care plan, it is very essential to fill the patient's information. So the name of our patient is Mr. George Boateng. That's the inpatient number. He's 42 years old. He's a male. He's a farmer by occupation or profession. The name of the doctor is Dr. Gabriel Conla. Date of admission is 21st of February 2025. He's admitted to the male ward. He's admitted to bed number 2. He's a Christian by religion, and he has been diagnosed with severe malaria. No surgical operation has been done yet, and he has not yet been discharged. So this information needs to be filled within a minute, taking note that a care plan should last for 20 minutes. During examination or standard procedure, it should last for 20 minutes. Then you move on quickly to your patient problems. With regard to the patient problems, it is very important to prioritize the problems. So if a patient has high body temperature, it should take priority than loss of appetite. So in this case, our patient's first problem was patient has a high body temperature, and it was 38.1 degrees Celsius. Patient is vomiting as our second problem. Patient complains of severe headaches was our third problem. And our final problem was patient complains of loss of appetite. When it comes to the patient allergies, we write boldly if patient is allergic to anything. And if patient does not know what he or she is allergic to, then you write patient has no known allergies. We make sure we add the no known allergies so that it does not look like patient has no allergies at all. It might be that they do not know their allergies. Then we quickly move on to the patient's strength. The strength refers to resources or abilities a patient possesses that can contribute to the ability to cope with illness or recover. Okay, so in this case, our patient's strength for high body temperature is that patient can tolerate tepid sponging. I guess as nurses we already know what tepid sponging is. With our second problem, which is patient is vomiting, patient strength is patient can tolerate both liberal and intravenous fluids. Now, liberal fluids are fluids that we can take via mouth, which include water, coconut water, ORS, and the rest. Now, the patient's strength for our third problem, which was patient complaints of headaches, is that patient can verbalize the severity of headaches for adequate management. In this case, the severity of the headache, whether when you rate on a pain scale, it is 4, 8, 9, will determine the type of painkiller to give. With our last patient's strength, which was patient has loss of appetite, the strength is patient can eat food served in bits. That patient might not be able to eat all at a go, but he or she can eat in bits. Now, with our TPR routine care, we have TPR, which is monitored 4 hourly. Blood pressure is also monitored 4 hourly. We are given nutritious diets. For fluids, as we said earlier, we are maintaining liberal and intravenous fluids. Intake and output is monitored and balanced daily. With our oral hygiene, patient maintains his oral hygiene twice daily with toothbrush and toothpaste. He also baths daily with sponge and soap. For our urine testing, it has not been requested. Body weight on admission was 65 kilograms, but we are not monitoring it on a daily basis. And finally, our activity is ambulant. Ambulant represents a patient who can move around in bed. This brings us to the end of Nursing Care Plan Part 1. Thank you all for watching and see you in Part 2. Bye.